Hello everyone, my name is HANNANI and I am here to share insight about our groups from Public Health Awareness, which is Diabetes Defense Your Action Plans for Health, which is held at Amanjaya Mall, Sungai Petani, in collaboration with Metro Specialist Hospital. The event took place on the 4th of January 2025 and aimed to raise awareness and promote healthier lifestyle habits to combat diabetes. Today, we will be doing a post-mortem of the event by reviewing it through the 10-step strategic planning model. My team members and I will explain each of the steps, starting with step 1. Our campaign addressed a significant public health concern, which is the rising of diabetes in Malaysia, particularly in Kedah. We focused on promoting awareness about diabetes management and also prevention. We believe our efforts were successful in achieving this goal. During the campaign, we introduced participants to diabetes plate model, educating them on meal proportioning and balanced nutrition. We distribute brochures with practical information on the risks and causes of diabetes, alongside with healthy recipes designed by our team members to encourage better eating habits. It is found out that the majority of our participants were in the target age of 30 to 60 years old, which aligned with our campaign focus. Additionally to that, Metro Specialist Hospital also provide free glucose and blood pressure screening for 150 participants to promote early detection.
Next, we held our diabetes awareness campaign at Amanjaya Mall, Sungai Petani, targeting visitors and local residents. This campaign aimed to raise awareness about diabetes and was conducted in collaboration with other groups, focusing on public health issues, including dengue and HIV. One challenge we faced during the campaign was capturing people's attention. To address this, we partnered with Metro Specialist Hospital to offer free health screening and glucose tests. This initiative allowed individuals to monitor their health and increase engagement with our booth. Additionally, we teamed up with Sultan Abdul Halim Hospital to organize a blood donation drive near our campaign booth. This collaboration not only encouraged participation but also drew more visitors, making the event even more impactful. Our campaign also featured healthy living workshop where we shared recommendations for diabetes-friendly recipes, particularly for those who had just completed their glucose test. To ensure attendees left with valuable resources, we distributed brochure packed with essential information about diabetes, including its definition, risk factor, prevention strategy, and management tips. To embrace technology and enhance accessibility, we include QR codes in the brochures, allowing participants to explore healthy recipes they could easily prepare at home. We hope that our efforts during this campaign will leave a lasting impression and inspire positive changes among the attendees, encouraging healthier lifestyle and greater awareness of diabetes.
Next is step 3, select priority audience. The primary audience is individuals at higher risk of developing lifestyle-related disease. These individuals can benefit most of early detection and adopting preventive lifestyle changes. We have analyzed the audience based on several dimensions. First is demographic, individuals aged from 16 to 40 years old. This group includes all gender from middle to lower income backgrounds such as secondary school students, university students, and working adults. Next is geographic. Our campaign is centered in Sungai Petani, particularly at Amanjaya Mall, a strategic place that attracts families, students, and also workers. Next is physiographic. Audience values convenience and affordability, showing moderate health awareness but often struggling to maintain consistent healthy habits due to lifestyle constraints. And the last one is behaviorals. The audience shows mixed readiness to adopt healthier behaviors, ranging from passive awareness of health risks to those motivated without knowing how to start. And the current behaviors of the audience include irregular health screenings, high consumption of processed food, sedentary lifestyle, and reliance on reactive healthcare instead of preventive measures.
Our campaign successfully achieved its objective. For the behavior objective, about 85 people participated in glucose and blood pressure screening, and some of them who show early signs of diabetes were guided to follow-up consultation by Metro Health specialists. For knowledge and belief objective, we raised awareness about portion control using diabetes plate. Over 100 individuals actively engaged in the demonstrations and discussion, and feedback from them reflected a high satisfaction with the presentations and recipe suggestions. As part of our target goals, we distributed over 100 brochures and flyers to attendees, ensuring widespread knowledge sharing and engagements on public health awareness.
One of the biggest challenges we identified before the event was the lack of knowledge about balanced meals. Through interactive sessions and visual aids, participants gained a clearer understanding of the diabetes split concept. Many also shared that they now see the importance of diet in managing diabetes. Hearing from experts and real-life testimonials helped boost their motivation to make healthier choices. Cost was another major concern. We tackled this by introducing affordable meal planning strategies and practical grocery lists, making healthy eating more accessible. Time constraints were also addressed with quick and easy meal prep demonstrations. Attendees now feel more confident about fitting healthy meals into their busy schedules. And of course, culture and social influences play a big role in our eating habits. We made sure to showcase culturally diverse meal options that align with the diabetes split, so making healthy choices in social settings feel more achievable. We will go over the key benefits our participants gained from learning about the diabetes split. One of the biggest takeaways was the sense of control. Many participants shared that they now feel more confident in managing their diet without feeling restricted. The simple structure of the diabetes split made meal planning easier and more practical for daily life. Through hands-on activities, attendees learned how to portion their meals correctly. They left the event feeling more capable of making informed food choices. Many also shared a sense of accomplishment in understanding how to balance vegetables, proteins, and whole grains. For many, adopting the diabetes split is more than just about food. It is about aligning their actions with their health goals. The event reinforced the importance of making meaningful changes that support long-term well-being. Participants felt motivated to take proactive steps in their journey to better health. For product, the diabetes split proved to be a simple yet powerful tool in helping people understand balanced meals. Our printed materials, digital resources, and interactive workshops were well received, giving participants clear and practical guidance of managing their diet. Price: offering free resources at the event ensured that everyone could benefit without financial concerns. Many attendees appreciated the accessibility and the opportunity to learn at no cost. The third one is place. Ahmad Jaya Mall was the perfect location, attracting a diverse crowd and allowing for walk-in participation. Our partnership with Metro Hospital added credibility, making people more confident in the advice they receive. But last but not least, which is promotion. Our social media campaign reached a wide audience with high engagement on posts featuring healthy recipes and diabetes tips. The talks by healthcare professionals will also highlight providing valuable insights on diabetes management. Let's look at how we address competition and engage key influencers. First, competition. We know that fast food and processed snacks are popular because they are quick and affordable. However, participants found the diabetes split a practical way to make healthy choices without feeling restricted. Cultural foods can also be a challenge, but our event showed how traditional meals can be modified to be diabetes friendly while keeping their great taste. Compared to expensive meal plans and weight loss programs, attendees appreciated the simplicity and accessibility of the diabetes plate as an everyday solution. Second one is influential others. Healthcare professionals from Metro Hospital played a big role in building trust, ensuring the expert advice backed our campaign. Many participants shared that the resources helped them involve their families in making better food choices together. Finally, local community leaders and influencers help spread awareness, making our message even stronger. Overall, this campaign successfully addressed challenges, engaged trusted voices, and empowered individuals to take control of their health.
Our campaign's positioning statement is diabetes defend, prevent, and maintain. We believe we fulfill this statement effectively because for detection, screening conducted by Metro Specialist Hospital has helped participants monitor their glucose level. For prevent, our interactive brochure provides essential information on lifestyle changes and diabetes risks. And for maintains, we empowered participants by sharing diabetes-friendly recipes to support long-term healthy meal planning. It could say that many participants appreciate our recipe ideas, monitoring that they often struggle to find suitable meal options despite having diabetes. And overall, our campaign successfully empowered participants to manage their health more proactively and make more life-changing choices to their lifestyle.
Next is step 7, develop strategic marketing intervention, makes 4 P's. First is product. The core product is improving health outcomes through portion control education and early detection of diabetes. Participants will engage with the diabetes plate model for portion guidance, free healthcare screening, and receive informational brochures. To further enhance value, goodie bags provided by Metro Specialist Hospital will include tools like glucose meters and recipe cards. Second is price. Participation is free, removing financial barriers for the attendees. Tapa UiTM also sponsoring the cost for materials like brochures and flyers. The next 4 P's is place. Ahmadjaya Mall is our campaign venue, a high-traffic, easily accessible location. The event is scheduled for the weekend to attract maximum foot traffic and spontaneous participation. And the last 4 P's is promotion. We will leveraging flyers, brochures, and social media platforms including Ahmadjaya Mall's Instagram and UiTM Kedah Telegram and WhatsApp group to spread awareness about the event and its offering.
I'm really excited to share the result of our recently completed campaign on diabetes awareness and prevention. To begin with, we focus on creating input materials such as wonderful brochures, QR code, and posters. These resources provide essential knowledge about diabetes, its risk, and the importance of our lifestyle changes. Our goal was to educate and empower participants to make healthier choices. During the campaign, we execute the plan output by distributing this material and simple briefing about healthy menu and diabetic plate. Over 18 people or participants actively engaged in the program, and many check their blood sugar level for the first time, increasing their understanding of diabetes and its prevention to it. So when we measure this impact? So for the pre-campaign, we collected baseline data through survey and participant discussion. So during the campaign, we monitor the progress with midpoint check-ins, and after the campaign, we follow up to assess sustained behavior changes and the program effectiveness. Finally, how did we measure it? We use both qualitative and qualitative methods. Quantitatively, we track participant numbers and blood sugar test result. Qualitatively, we gather back feedback, personal story, and reflection from participants. So this combination provides valuable insight into the campaign success.
As for budget and funding, we effectively utilize the resources allocated for this campaign. Tapa UiTM provided RM100 for the campaign, and Metro Specialist was a crucial partner as they fully funded the screening material and goodies bag. For the budget breakdown, RM50 was allocated for brochure and RM24 for diabetes plate printing for our group. This material play a significant role in promoting the campaign and educating participants. Metro Specialist Hospital also contribute glucose test, blood pressure screening, and 150 goodies bag. Their support ensured that we could focus on delivering high quality services to the community.
We follow all the steps in step 10 to implement and sustain our campaign effectively. First, we will begin with an initial briefing by Metro Specialist Hospital. They will ensure hygiene standard of follower and conduct proper blood glucose testing for audiences. Next, we have prepared a scheduling process to reduce waiting time for participants. Alongside this, we will provide educational materials such as brochure on diabetes prevention and healthy lifestyle practices. Lastly, we will organize the exhibition site to ensure smooth participant flow. To avoid congestion, we will offer early registration for glucose testing participants. So, who are responsibility in this campaign? Firstly, Metro Specialist Hospital that will handle glucose testing and consultation. Secondly, we, UiTM student as event coordinator that will manage the event, engage participants with activities and demonstrate healthy practices. And lastly is Ahmad Mall Management. They will provide the venue, assist with crowd control and promote the events. Campaign has been done on Saturday, January 4, 2025, starting from 10 a.m. to 3 p.m. The total cost is RM100, fully sponsored by TAPA UiTM to cover material and brochures.
To conclude, this campaign is more than just a one-time event. It's a strong foundation for creating long-term health awareness in our community. By focusing on diabetes, we aim to inspire meaningful and lasting changes that improve life. Our goal is to provide people with the knowledge, resources, and practical tools they need to take charge of their health and manage it effectively. As the saying goes, prevention is better than cure, and we believe that by raising awareness and empowering individuals, we can reduce the impact of diabetes and make a real difference. This effort isn't just about helping those affected today, but it's about inspiring healthier habits that will benefit future generations. Together, we can create a ripple effect that leads to a brighter and healthier future for everyone.